Imagine you're sitting right now, watching this video. What's the position of your head? How is your neck aligned? Now think about something that's probably not so obvious. How do your teeth meet when you close your mouth? And where is your jaw positioned? It may seem surprising, but these seemingly small details related to the mouth have an incredible influence on your posture and overall well-being. It's common to think of posture as something related to the spine or the muscles in your back. However, the relationship between the jaw, teeth, and posture is an area of study that has been gaining increasing attention in science. Improper jaw alignment and dental dysfunctions not only cause localized problems, such as facial pain or difficulty chewing, but also generate impacts that reverberate throughout the body, affecting the cervical spine, shoulders, trapezius, and even the lower limbs. Recent research in dentistry, physiotherapy, and biomechanics shows that dental malocclusion and temporomandibular dysfunction, TMD, can trigger musculoskeletal pain, alter body alignment, and compromise postural health. Additionally, tooth loss is a significant factor that directly impacts the spine. When left untreated, this condition can cause muscle imbalances and even lead to the development of chronic pathologies in the lumbar and thoracic regions. Therefore, in this video, we will explore in depth the connection between the jaw, teeth, and posture. We will begin by understanding how anatomy and biomechanics interact to influence body posture. We will then discuss temporomandibular dysfunction, TMD, and its impact on the cervical and trapezius muscles, as well as detailing how tooth loss can affect the spine. Finally, we will discuss multidisciplinary strategies to prevent and treat these problems, promoting an integrated approach to improving your quality of life. Have you ever stopped to think about how something as small as your teeth and jaw can directly impact your posture and cause pain in various parts of your body? At first glance, oral problems may seem isolated, but science has shown that the health of your jaw and teeth plays a crucial role in how your body aligns and functions. Imagine waking up with headaches, neck tension, or shoulder discomfort without knowing that the culprit may be inside your mouth. This article explores this surprising and often overlooked connection in detail to help you understand how problems with the temporomandibular joint, TMJ, tooth loss, or even malocclusion can trigger a cascade of changes in your posture and overall health. The jaw is a fundamental piece of the human body's balance. It is responsible not only for chewing, speaking, and breathing, but also for aligning the base of the skull and interacting with the spine. Any dysfunction in this structure can cause a domino effect, impacting the muscles, nerves, and joints of the neck and shoulders. Additionally, missing teeth or bite problems can alter the way you chew, breathe, and even walk, creating muscle tension that can spread throughout your body. In this video, we'll take an in-depth look at how your jaw and teeth may be affecting your posture and causing chronic pain. We'll also discuss the role of temporomandibular disorders, TMDs, in neck and muscle problems, as well as the devastating effects of tooth loss on the spine. Get ready to discover a new perspective on health that could transform your quality of life. Are you ready to learn how small adjustments can transform not only your posture, but also your overall health? Let's get started. The relationship between the jaw and posture is a complex area that involves the interaction between the muscular, skeletal, and nervous systems. The jaw is connected to the skull by the temporomandibular joint, TMJ, an extremely sensitive structure responsible for movements such as chewing, speaking, and swallowing. When this joint is misaligned or overstressed, the muscular reflexes that support the jaw can directly affect body posture. For example, a malocclusion, when the upper and lower teeth do not fit together properly, can lead to a compensatory repositioning of the jaw. This repositioning, in turn, requires the muscles of the neck and cervical region to work excessively to maintain the balance of the head. As a result, chronic muscular tensions can arise that impact the alignment of the spine. In addition, the nervous system also plays a crucial role. Sensory receptors located in the teeth and the temporomandibular joint send signals to the central nervous system, influencing muscle tone throughout the body. An imbalance in these signals can trigger poor postural patterns, contributing to musculoskeletal pain and functional limitations. This relationship is widely documented in the scientific literature, with studies demonstrating that dental interventions can significantly improve posture. For example, the use of occlusal splints to correct jaw misalignments has shown promising results in reducing neck pain and realigning posture. In addition, the integration of dental treatments with physical therapy has proven to be an effective approach for more complex cases. It is also worth noting that poor posture caused by jaw problems can create a vicious cycle. When the head is pushed forward due to tension in the jaw, the body's center of gravity shifts, requiring compensation in other regions, such as the lumbar spine and hips. These compensations, in turn, further overload the muscles, perpetuating discomfort and pain. The jaw does not work in isolation. It is connected to the skull through the temporomandibular joint (TMJ). This joint is one of the most complex in the human body, responsible for movements such as opening and closing the mouth, chewing, and speaking. Because it is closely connected to the skull and consequently to the cervical spine, any dysfunction in this joint can generate compensations in other parts of the body. When the jaw is not aligned, it forces the muscles of the neck and head to work excessively to compensate for the misalignment. This creates tension in the suboccipital muscles, which connect to the base of the skull and the first segment of the cervical spine. As a result, people with TMJ problems often report headaches, neck tension, and even radiating pain in the shoulders and back. Your teeth also play a crucial role in how your jaw is positioned. Malocclusion, when your teeth don't fit together properly, can lead to improper jaw positioning, putting strain on the TMJ and surrounding muscles. This strain not only causes pain, but also changes your postural balance. Studies show that people with malocclusion often have an altered center of gravity, which can lead to long-term back and knee pain. Jaw problems create a domino effect that affects multiple parts of the body. For example, a misaligned TMJ can cause cervicalgia, tension in the neck muscles due to craniomandibular misalignment; functional scoliosis, a postural misalignment that occurs as a compensation to correct jaw imbalance; shoulder pain, due to tension in the trapezius and rhomboid muscles, often exacerbated by jaw dysfunction. What is TMD? Temporomandibular dysfunction (TMD) is a generic term that refers to problems with the temporomandibular joint and associated muscles. These problems can include pain, clicking, locking, and difficulty chewing. TMD is often associated with factors such as stress, bruxism, teeth grinding, and jaw trauma. How does TMD cause neck pain? The TMJ is connected to the cervical spine through a network of muscles and fascia. When this joint is dysfunctional, it overloads the muscles of the neck, such as the sternocleidomastoid and scalenes. This overload causes stiffness and pain in the cervical region, which can radiate to the shoulders and upper back. Temporomandibular dysfunction, TMD, is a multifactorial condition that affects the temporomandibular joint, masticatory muscles, and associated structures. Studies indicate that more than 70% of people with TMD report pain in the cervical region, highlighting the close relationship between these structures. One of the main connections between TMD and the cervical spine is the muscle chain that connects the mandibular region to the spine. The suboccipital, scalene, and trapezius muscles are often overstressed in individuals with TMD. This overstress can lead to a head-forward posture, a common pattern in which the head is projected forward in relation to the spine, increasing tension in the cervical muscles. In addition, TMD can cause changes in the body's balance. Chronic pain leads to involuntary postural adjustments, such as raising the shoulders or rotating the neck to one side, aggravating tension in the trapezius and cervical region. These patterns can eventually compromise mobility and increase the risk of muscle injuries. Another relevant aspect is the interrelationship between TMD and psychological stress. Stress can exacerbate tension in the masticatory and cervical muscles, intensifying TMD symptoms and contributing to a vicious cycle of pain and postural misalignment. Therefore, therapeutic approaches that include relaxation techniques, such as mindfulness and biofeedback, have shown significant benefits in the management of TMD and in improving posture. From a clinical perspective, it is essential to perform a comprehensive evaluation of patients with TMD. This includes not only examination of the temporomandibular joint and teeth, but also a complete postural analysis. Tools such as biomechanical analysis, radiographs, and muscle strength testing can help identify compensation patterns and guide an effective treatment plan. Tooth loss is a common condition, especially in older populations, and has significant implications for general health and posture. When a tooth is lost, the occlusal balance is altered, leading to a displacement of the jaw and, consequently, changes in body posture. The impact of tooth loss on the spine is related to the redistribution of the masticatory load. When one or more teeth are missing, the masticatory muscles work asymmetrically, generating excessive muscle tension on one side of the face and neck. This asymmetry can spread to the cervical and thoracic spine, resulting in spinal misalignments and chronic pain. In addition, tooth loss can lead to atrophy of the maxillary and mandibular bones, altering the facial structure and the support point of the spine. These structural changes can compromise postural alignment, increasing the risk of pathologies such as functional scoliosis and low back pain. Another crucial point is the relationship between tooth loss and reduced quality of life. Studies show that toothless individuals often report difficulties chewing, speaking, and even smiling, which can lead to behavioral and postural changes. For example, trying to hide a smile can result in a hunched posture, aggravating spinal problems. Oral rehabilitation, such as the placement of dental implants, is an effective solution to prevent and correct postural problems associated with tooth loss. In addition to restoring masticatory function, implants help maintain occlusal balance and prevent bone atrophy, promoting proper postural alignment. Physiotherapy plays an essential role in the treatment of temporomandibular dysfunction, TMD, addressing the complexity of this multifactorial condition that affects the temporomandibular joint, TMJ, and masticatory muscles. Physiotherapy methods aim primarily to relieve pain, improve functionality, and restore the patient's quality of life. Treatments begin with a detailed assessment, which includes posture analysis, TMJ examination, and evaluation of the masticatory muscles. Observation of the jaw's range of motion, muscle palpation, and assessment of facial symmetry are essential components of this process. Analysis of daily activities and parafunctional habits, such as bruxism or clenching of the teeth, is also considered, as they directly influence the manifestation of TMD. One of the most common approaches in physiotherapy is the application of manual therapies, such as joint mobilizations and gentle manipulations of the TMJ. These techniques help to reduce muscle tension and restore joint mobility. In addition, myofascial release is often used to relieve painful trigger points in the masticatory muscles, such as the masseter, temporalis, and pterygoid muscles. This release is done through direct pressure or specific stretching techniques, promoting relaxation and pain relief. Therapeutic exercises play a central role in the treatment of TMD. They include postural re-education movements, exercises to improve jaw coordination, and techniques to strengthen the masticatory muscles. These exercises are designed to promote stabilization of the TMJ, preventing relapses, and reducing the impact of adverse biomechanical factors. For example, mandibular proprioception exercises help to improve the perception of jaw movement, while targeted stretching relieves accumulated tension. Another strategy used by physiotherapy is the use of therapeutic resources such as heat and cold, therapeutic ultrasound, low-intensity laser, and analgesic electrical currents. Heat promotes muscle relaxation, while cold can be used to control acute inflammation. Ultrasound and laser work to modulate pain and improve local vascularization, accelerating the recovery process of affected tissues. Patient education is another pillar of physical therapy treatment for TMD. explaining the nature of the condition to the patient and guiding them on strategies to avoid harmful habits, such as clenching their teeth or chewing gum, is essential for therapeutic success. Relaxation techniques, such as diaphragmatic breathing and mindfulness, are also encouraged to help reduce stress, one of the factors that often aggravate TMD. Postural alignment is addressed through exercises that correct inadequate posture patterns, such as cervical misalignment or changes in head position. Inadequate posture can overload the TMJ and related muscles, aggravating the dysfunction. Therefore, the physical therapist teaches strategies to keep the head in a neutral position and adjust the positioning of the cervical spine during daily activities. In more severe cases, or those that are resistant to conventional treatment, the physiotherapist may collaborate with other health professionals, such as dentists, speech therapists, and psychologists, in an interdisciplinary treatment model. This approach is especially important in patients with associated psychological factors, such as anxiety and depression, which can perpetuate pain and hinder treatment progress. Finally, the physiotherapist constantly assesses the patient's progress to adjust the treatment plan as necessary. The frequency and intensity of physiotherapy sessions are personalized, based on the severity of the TMD and the patient's response to interventions. This ongoing monitoring ensures that therapeutic strategies are optimized to achieve the best possible results. Throughout this video, we explore how the jaw and teeth play a key role in posture and musculoskeletal health. From the impact of malocclusion to the consequences of temporomandibular dysfunction and tooth loss, it's clear that the human body is an integrated system, with every part interconnected. The takeaway message is clear. Taking care of your oral health isn't just about aesthetics or chewing, it's also about your overall well-being. Consulting dental, physical therapist, and other health professionals is essential to identify and treat problems that may seem isolated but actually have ramifications throughout the body. The relationship between oral health and posture goes far beyond what you might think. Jaw problems, misaligned teeth, or missing teeth can trigger chronic pain and impact your quality of life. The good news is that many of these problems can be prevented or treated with the help of health professionals, such as dentists, physical therapists, and doctors who specialize in chronic pain. If you suffer from chronic neck, shoulder, or back pain, consider evaluating the health of your jaw and teeth. Small adjustments to your bite or treatment for TMD can make a significant difference in your posture and overall well-being. Remember, your body is an integrated system, and taking care of each part of it is essential to living a more comfortable and quality life. Finally, I invite you to reflect on how small actions, such as seeking treatment for jaw pain or replacing missing teeth, can transform your quality of life. Posture is more than a matter of appearance. It is a reflection of your body's internal harmony. And you, how are you taking care of your posture today? Understanding these interrelationships can be a turning point in your journey to a healthier and more balanced life. Always seek out qualified professionals. Invest in taking care of your oral health, and do not underestimate your body's signals. After all, every detail matters when it comes to achieving balance and well-being. See you in a new video.